Hi everyone. Today we are going to discuss about a topic known as intussusception. Intussusception is a rare condition, but life-threatening condition. It can be defined or it can be explained as a type of condition in which an intestines telescope to each other, or is the invagination of an intestine to one another. When we say invagination of an intestine to one another, it's just simple as like this. Invagination. It invaginates to each other like this. That is, it goes into each other. Now when we say telescoping, we are talking about like this. That is telescoping. It twists to each other like this. So it telescopes to each other. That is telescoping. Thereby leading to what? Bowel obstruction, ischemic, and potential life-threatening. That is intussusception. So types of intussusception. We have one, ileocolic intussusception, which the small intestine invaginates to colon or telescope to colon. Then we have number two, ileoileal. Ileoileal is a type of intussusception where the ileum telescope to ileum, or it invaginates to ileum. The third one is colocolic. So colocolic is a type of intussusception where the colon invaginates to colon, or it telescope to colon. It telescope to itself. So those are the types of intussusception. And then what are the causes of this intussusception? Number one, we have infection. Infection can cause intussusception. We have trauma or tumor of the abdomen, which can cause intussusception. And then we have idiopathic. Idiopathic also can cause this intussusception. And then we have anatomical abnormalities. Anatomical abnormalities also can cause intussusception. And then we have signs and symptoms of this intussusception. So when somebody is suffering from intussusception, the signs and symptoms are excessive sweating. The person will present excessive sweating and abdominal distension. The abdomen will swell up, it will distend. So abdominal distension. And then we have severe pain. The severe pain will be there. We have severe pain. Severe pain. The person will be feeling pain so hardly and so evenly, very severely, very painful. And then we have vomiting. So the vomiting will be there because the abdominal content would like to pass in or to pass out, in which there is no way. There is a blockage. So once there is blockage, you can't go anywhere. You are going and you find a hold up, and maybe peradventure this hold up cannot allow you to even have a small way to pass, or doesn't have any small passage. Then you have to stop there, or you reverse back. That is exactly what happens. It's just like a blockage. So definitely the abdominal content has to what? Comes back, regurgitates. And then we have bloody stool. The bloody stool, the person will be passing bloody stool. That is another sign and symptoms. The person will be passing bloody stool. As I said earlier, the abdominal distension will be there, severe pain, excessive sweating, bloody stool, and then vomiting. So what are the diagnosis investigation? The diagnosis investigations, we have air enema. So this air enema, why we do air enema is to what? To know the presence of this intussusception in the intestine. And then another one is image studies. So this image studies is MRI, and we have abdominal scanning. So we do scanning in order to know the blockage and where the blockage exactly is. And at the same time, we have surgical intervention. We have treatment regimens. So this treatment regimen is surgical intervention and air enema. So air enema is to reduce, or air enema procedure is to reduce the accumulation of gas in the what? In the intestine, in order to free or easy passage of the bowel contents. And then surgical intervention is done to correct the abnormalities or anatomical abnormalities, or to correct the blockage of that particular region that is telescoped. Those are the treatment intervention. And then we have complications. So the complications of intussusception is the complications are bowel obstruction. Yes, we have bowel obstruction. So that is number one complication, this bowel obstruction. And then this bowel obstruction is, we can say, bowel ischemic. That is the perfect word to use. Bowel ischemic. And then we have perforation. So it causes intestinal perforation, definitely. It causes intestinal perforation. And then we have sepsis. Now, because the bacteria are there, causing the infection around those blockage, then definitely sepsis must set in. So those are the complications, and probably death. That is, if intervention is not taken proper or on time, definitely the person must die. It may cause death. So this is just the hint of intussusception. It's a very rare condition being found, but when you found it, it's a life-threatening condition. If at all, intervention do not take place on time. Take note and keep following for your updates. Thank you.